Hello, Maralinda.
Hello, Elena. Nice to see you.
Nice to see you too. Nice to see you too. So I have three questions related to knowledge transfer for you today.
Okay.
The first question is, how is knowledge transfer defined in the nursing context?
Okay. So that's a very good question. And there could be actually several answers to this question. So I will address it from 2 points of view. Okay. So the first one is really how do we transfer knowledge that comes from research and from clinical expertise into practice? So, of course, it's always very important for patient outcomes and patient safety to continuously improve nursing practice, right? So, and as you we know, medical research develops very, very quickly these days. So, basically, would ideally want your nurses to put into practice as quickly as possible what will give the best results for patients, health and survival and wellness and all this. So that's one aspect of knowledge transfer where we really are concerned about equipping the nurses with the most cutting edge research that has been tested and proven, right? That works. That's one aspect of knowledge transfer. The other aspect of knowledge transfer is basically having senior or expert nurses, or maybe even just some nurses that are experienced in one unit or in one field, to transfer knowledge to either new nurses or nurses taking over. It could be as simple as having a knowledge transfer from one shift to the next. Saying okay, well, this case has evolved this way, so when you come in for your shift, you need to make sure to check these vitals and to check for this, or that kind of thing. So it could be as simple as that kind of knowledge transfer, or it could be as, I want to say, implicit, okay, as a senior nurse who has worked for a very long time in a specific unit, let's say the NICU for neonatal intensive care, and who are seeing nurses, new graduates coming out of school, whether DEC or bachelor or master's, but who have never really practiced in the NICU. And so the challenge here is, how do the senior nurses, share their clinical expertise with these junior nurses? A lot of junior nurses feel like they're very ready to take on the world and save everybody's lives. And sometimes there's some of the clinical knowledge that they're missing just because they don't have so much experience. So those are the two main knowledge transfer areas that we work in nursing.
That's cool. That's interesting. Second question was, how does a head nurse see or understand or know that transfer has happened with the newer recruits?
Well, it's fun because nursing is very hands-on and it's very practical discipline. So there's several ways to see that. The first one could be just to question them, just to say, okay, what do you know about this case? Usually they'll take a specific case or a specific patient or a specific area of the unit. And ask questions, kind of not necessarily drill them, but something that sounds like that, right? And then another way will be to observe them, to observe how they're treating the patients, how they're documenting. That's a big area of work in nursing, especially when it comes to handing off, going from one shift to the next.
Yes.
And even sharing that information with other professionals. So sharing with the doctors, sharing with the, if they have people from allied health, if they have physiotherapists or social workers or other people who are working with them, to see how well they also transfer that knowledge. The thing is, in nursing, we're fortunate to have a system called preceptorship. It's a bit like mentorship, although it's not exactly equivalent. But basically, when a junior nurse comes onto the floor, they are kind of shadowed or supervised lightly. Okay, it's not a supervision that is, step by step, like, what are you doing now? What are you doing now? It's not a micromanagement type of thing, but it's more in the sense of a guidance, like a person who has experience on the unit, who is designated to guide this junior nurse. And some of them may only have, some of the preceptors, so some of the guides could have maybe as little as 2 years of experience, but they already have that much more than the junior nurse. So that's actually a structured way for us to look at knowledge transfer, both to do it, to affect it, and also to evaluate it, to see if it has actually happened before those nurses are actually licensed and autonomous to go work on any floor.
This is interesting. Perception. Like
Yes.
Perception.
Yes. They're very close. Yeah.
New word I'm learning with you. The question is, tell us about community practice. I know this is big in the nursing environment. How does it happen? What does it mean?
Okay. So communities of practice are a big thing in nursing, but they can also take several forms. And it really, I think it depends a lot on the needs of each unit, each group. So I'm going to start by saying, there's a lot of communities of practice that get formed around a patient population. And so that means that a lot of the nursing communities of practice are actually not exclusively nursing. We'll call them more like interprofessional communities of practice because they're centered around a specific care. So I'll give an example. There are communities of practices out there for pediatric neurology. So you'll find in that community of practice, and it can be at any scale. It could be at the provincial scale. It could be at the, Canadian or national scale. And it could even go all the way to international scales, right? But you'll find in those communities of practice, people who are, let's say, pediatric neurology, you'll find neurologists, you'll find pediatricians, you'll find physiotherapists for children, you'll find occupational therapists for children, you'll find psychologists, you'll find nurses, of course, and then you'll see that they all work together. And what's interesting about the nursing aspect of the community of practice is that the nurses, because of how close they are to the patients, they have a special role to play in explaining to the community of practice the role of family as well in the care of the patients. So they bring a lot of that aspect into their work with the rest of the communities of practice. They also are very good linkers. They're very good at linking people to each other within the community of practice. So often you'll find that nurses bring in new people into the community of practice, right? Now, in the mechanism of how they share information, they will bring both research findings or what has been proven by science to improve practice or to improve sometimes even processes within the unit. So, okay, well, in the past, I don't know, for example, we would do assessment A and then assessment B, but then we found that it's actually better to do assessment C first and then A and B after, because then we can triage the patients better, that kind of thing, right? Okay. And the thing is also, they will, so I said they link people together, they bring in new people, and in the knowledge that they transfer, they're also going to, with that, transfer their own clinical expertise. So what they've seen with the patients, and what they see works better in terms of patient compliance, right? Okay. Sometimes we have really bright ideas about what we want to impose on patients or what we want to give them as treatments. And then they'll be the ones who give the wake-up call, who are like, well, wait a minute. Okay, we tried that. And, as good as this is proven by science, we find that, well, there's very little patients that want to do that because they have this side effect that is too strong. So what do we do, right? So sometimes they will be the founders of the community of practice and sometimes not. Okay, so they're not always the starters of the community of practice, but they certainly are the ones who nurture it in a large part, And I believe that's what I have to say about the communities of practice. And there's several. I just wanted to add one more thing. There's several communities of practice, but really the trend is that they're mostly centered around a specific care population. So there's also chronic pain communities of practice. There's and because of that, most of the time they're not exclusively nursing communities of practice, unless we're talking about communities of practice around the nursing professional orders that you will find. Okay, like the OIIQ in Quebec will have a community of practice. The RNAO in Ontario has a community of practice that you could follow. And some nurses follow several of them across the world to see differences in practice across the world and how we could improve ours. But yeah, so those are really the main ones. There's exclusive ones that are around, like nursing, that are around professional orders, and then other ones that are interprofessional.
That's so interesting. I just have one more question for you, Marlinda.
Yeah.
A community of practice, is this more like a networking event where people go every 3 months? Is it like a workshop where people come with different cases? Like, what's the logistics of it? How does it happen? What kind of c'est quoi la face? What's
right.
How does it happen? How does it occur?
So it could actually happen in several ways. You tapped on the important feature of it, is that it's a network. Absolutely. The way that it starts actually has there's different mechanisms in which it could start. Sometimes it started with scientists who knew each other and who just linked together.
Yeah.
It could be at a physical event. I know right now during COVID, like it's a little bit hard to have any of those, but it could be at a conference where all of a sudden, nurse A from Alberta met nurse B from, Nova Scotia, and they're like, oh my goodness, we're working on the same stuff. We should connect together and share our expertise, right? Or share our understanding, our knowledge, etc. So it could start that way, right? With the professional orders, I think it's more just that the network already exists, and it's just a matter of communicating more often with each other. Okay. So there's different ways in which it could start. Sometimes it starts as simply as two friends. Very honestly, two friends who are working in the same field, right? Or that working in the same hospital, in the same unit, who connect with somebody else on another unit, But the feature of it is that it's a network that may or may not grow, but certainly they grow in understanding or amount of knowledge that they share with each other. And that's the thing, is that they share knowledge with each other. And some of them will have regular meetings. They'll say, okay, every month we're going to meet online, for example. Other times they know that the network exists and they basically just tap into each other when they need something, right? So, okay, I'm working on this, research project, right? I'm trying to evaluate patient experiences with referrals for mental health in the community, right? Okay. And I need to know if any of you have already worked on this. And if you do, do you have any understanding? Do you have any knowledge? Is there any place where I could call to get information? Things like that. So it doesn't have to be a very structured format. Okay. It could be a very informal, way of working. But it is a community, right? It is people who hold together and who will call upon each other, to answer the needs of information transfer, of knowledge transfer. Yeah.
This is so interesting. Thank you so much, Marlinda. Thank you.
You're very welcome. Thank you.